Hi, I'm Dr. Shilpa. Today's topic for discussion is surgery for fibroids. Surgery for fibroids is one of the very important aspect of the treatment because the medical management, that is with the tablets and injections, the treatment is never permanent, and surgery is the one which gives permanent solution for fibroids. Fibroids can be tackled with two modes of surgery. One is the laparoscopy route and the second one is the open method, and the type of surgery can be either just removing the fibroid or it could be removing the entire uterus. So what are the situations in which we counsel the patient for removing only the fibroid and retaining the uterus? And this procedure is called myomectomy. So this is done for women who have desire to retain the uterus, who are less than 40 years of age, who have fertility issues, who want to conceive, and in women who have single fibroids, where just removing the fibroids will cure the thing for them, and women who are having the fibroid for the first time without any risk of recurrence and without any risk of cancer. These are the women who will benefit largely from just removing the fibroid and retaining the uterus. So this is done usually through a laparoscopic method, which is a keyhole surgery or minimally invasive surgery, which is quite popular nowadays because of the ease with which the woman can come undergo the procedure and get back to her routine very fast. So the total duration of hospital stay during this kind of surgeries is roughly around 1 or 2 days maximum, and the pain is not much because it is a keyhole surgery, and the activity and also the recovery from the surgery is very fast in cases of laparoscopies. Coming to the open method of myomectomy, so we just cut open the woman's abdomen and we remove the fibroid in a very routine manner which has been done for many decades. So advantage of the laparoscopy is that it is the fast recovery and also the shorter hospital stay and less pain. So wherever possible, wherever it is available, I think the laparoscopy is the way forward, and that should be encouraged as much as possible. And the option is to be given to the woman that she can undergo a laparoscopic surgery. So when we talk about the other option, which is the removal of the uterus, where in situations like if the family is completed, if the woman is older than 40, if there are multiple fibroids, maximum I have seen about 40 fibroids in a woman, and if it is the second or third time that the fibroid is happening, and if there is a risk of cancer, then in these situations I think hysterectomy is the way forward. And hysterectomy again can be done either by laparoscopic route or by open method. So when we discuss about all these surgical options, the commonest and most commonly done option for a fibroid uterus in a young patient who has infertility is the laparoscopic myomectomy. So this is a procedure which is the most advanced one as of now, and the expertise is required, and in some places there may not be available. So this is something which everybody should know, that if they can choose as to if they have a choice as to what surgery they can do, I think they should go for laparoscopic myomectomy. So here there are a couple of steps which are extremely important. So the first step is like putting in the camera through that port which is just above the umbilicus, and in the sides we put around another 2 or 3 ports from where the instruments are put, and the procedure is done. So the procedure involves a couple of important steps, and that is like making an incision or cutting the uterus open and removing the separating the fibroid from its attachment to the uterus. And the next step is suturing the cut open uterus, which has to be done very precisely, and also removal of this fibroid, which is almost like a ball, into strips using an instrument called morcellator. Through that the hole which we have made, which is about 1 centimeter. So these steps are the ones which are crucial in cases of laparoscopic myomectomy, and each step is important, and these steps will determine how successful the surgery has been, where we give the best results to the patient with regard to like not having any complications post surgery, or not having any kind of the weakness in the uterus, and not have any problems in case if the patient conceives during pregnancy. So the utmost important thing in this is one, availability of the instruments for laparoscopy, and the second thing is the expertise and experience of the surgeon. So if these things are there, I think it is quite straightforward thing which is done routinely nowadays. And this whole of this procedure may take anywhere between 1 hour to 4 hours, depending on the number of fibroids, the location of fibroids, and the size of the fibroids, and also the expertise of the laparoscopic surgeon. So usually the fibroid surgery through laparoscopy is warranting only about, say, maximum 1 or 2 days of admission, and the patient is admitted, and the procedure is done under general anesthesia, and post procedure the patient is given antibiotics and painkillers, and then the follow-up is done after say probably a week or 10 days, along with the histopathology or the biopsy report of the fibroid which has been sent for testing. So usually later the follow-up is done once in, say, like 6 months or 1 year, looking for if there are any more fibroids which are coming up, or how she is doing, and if there are any other symptoms. So the surgery is one of the mainstay of treatment, and also this gives the permanency in the treatment for the woman. So thank you very much. I hope this information was useful. Thank you.